My name is Mark Swensen. I'm a general dentist for North Point Dental Group in Corvallis, Oregon, and we're just a general dental practice. I've graduated from dental school in 2007, so I've been out of school for 2 years. I've been practicing for a year. I did a year-long general practice residency in Columbia, South Carolina before I joined this practice in Oregon. The pros and cons of joining a practice versus starting a practice, there's quite a list of them. My situation is maybe a little different in that I'm going through what's called a practice transition, where it's a brokered, kind of facilitated transition over a number of years. The first year consists of working for the dentist, and then there's what's called an equity accumulation phase, where money's being put away for a down payment, and then the deal is closed and you become a full partner. And the main advantage of this is that it enables you to acquire the cash flow needed to service the debt that you're going to have to take on when you buy into the practice. There's some built-in built-in time to see if you're compatible, so you don't have to commit to anything until you know you want to be committed, which is another advantage. But the huge advantage is that you assume a little less financial risk because you have some time to work your cash flow up. In terms of starting your own practice or buying your own practice, almost immediately the big con is just cash flow, especially when you're starting a practice. You don't have any guaranteed patients. There's no guarantee you've got any cash flow, and that can be a challenge when it comes to obtaining some financing for all that. And then there's the things, just experience, running a business, all those kinds of things are challenges for a new dentist, whether you're buying into a practice, whether you're buying outright, or whether you're starting your own. Dental education is an expensive venture. Even at your cheapest state schools, you're lucky to come in around $125,000, $150,000 of debt, and as you mentioned, the average is $250,000, and there are private schools where you come out even more in the hole than that. And it can really limit your options. If you do want to start a practice, the number one hindrance is just going to be finding somebody willing to give you the money to do it, with no record of earnings or production or anything like that. However, dental practices, by and large, are very successful, and they're probably much more successful than your average small business, and banks know that. And I think that if a good business plan is put together and the right channels are taken, I think you can do pretty well and find financing. But that is the number one challenge. Well, if you're buying in, that is a huge variable, and it's all dependent on the practice that you're buying into. A high-performing practice versus a practice where the previous dentist is really tapered back are going to be two different animals. So you can buy into a practice that's producing $1 million or $2 million a year, and that type of buy-in is going to cost you at least $500,000 to $750,000. Startup costs, I'm going to guess, are in the realm of $300,000 to $400,000, and if you're buying outright, that's really a function on the strength of the practice. The new dentist graduating from dental school has a number of tools that can help them finance a practice decision, whether it's a buy-in, a startup, or what have you. But there are companies, you can go to your traditional banks or traditional lenders, but there are companies that specialize in lending for dental practices, and they're very familiar with the industry, they're familiar with the risks, and they're familiar with just the whole deal. And so that can be an advantage, because I have a feeling, and I don't know this for sure, but I have a feeling that they'll be a little more willing to lend as opposed to a traditional lender would be in that position. Well, I think the best advice that I can give a new dentist is, you got to be willing to work hard. You got to be willing to assume maybe more financial risk than you thought you would have to in the beginning. And then you got to be really willing to work hard to hone your technical and clinical skills in the practice in order to produce the dentistry that you need to produce. My personal experience in my residency program that I did after dental school was phenomenal, and I would recommend that to anybody. And not everybody does them, and not everybody feels they need to do them, but for me personally, it was the best decision that I made in terms of the scope of clinical skills that I obtained and my ability now to produce dentistry as opposed to what it would have been otherwise. Both in terms of speed and efficiency, and also in terms of scope of practice and the types of procedures that I do that enable me to keep busy, that enable me to produce the dentistry that I'm going to need to sustain, you know, not only a lifestyle that we enjoy, but also, you know, the decision and opportunity to buy into a practice like I'm buying into. So to sum it up, I don't know exactly what all that means, but work hard, assume a little risk, and you'll be all right. Dental practices are hard to fail.